Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Haley Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hi, Dr. Luper. How are you?
Hello, Haley. I'm good.
Good. Glad to hear. We keep talking about fatigue, and there's a lot to fatigue. A lot of different elements that people may be experiencing and maybe affecting our patients.
Yeah, it's a common problem. Shows up. That's the reason why we're talking about it so much, because it's one of the things that people come to me over and over again. I'm thinking about today, and I saw 2 patients with fatigue today.
Yep, and then 2 on Friday. So
Yeah.
Yeah.
It's like that.
Yeah, it's everywhere. One thing I am curious on is how oxygen levels might be affecting your fatigue levels.
They do.
Oh.
Oxygen turns out to be important. So one of the things that we do here is when people come see us, we take their vitals.
Uh-huh.
We measure their blood pressure, we measure their pulse, we measure their temperature, we measure their oxygen.
Mm-hmm.
And I do that because it's helpful for me to figure out what's going on with folks.
Yeah.
It turns out to be really important. So with oxygen, if your oxygen levels are low, then your body can't function normally, and what it does is just kind of turns the dial down, and you just live a lower, quieter, slower, tireder version of your life. If we can get the oxygen levels to go up, and then you get a brighter, more energized, more vital version of your life. So it's absolutely a factor.
So, I mean, there's air everywhere. We're breathing all the time.
You're right.
So,
What's the dealio?
why aren't people getting
We're on
enough
space.
oxygen? Is it a breakdown in the way our body processes the oxygen, the conversion of oxygen?
Well, I wouldn't. Yes, there's more than that though. So the thing. Let me talk about finding out if you have a problem or not.
Okay.
And it's not hard to do. And then we'll talk about why and how to fix it. So if you want to know if you have a problem with your oxygen, it's very easy. You get one of those little oxygen meters, the ones that go
The oximeters.
the pulse oximeter
Yeah.
that goes on the tip of your finger.
Uh-huh.
They became very popular with COVID
Yes.
because people were trying to look at their oxygen levels to make sure whether they had to go to the hospital or not,
Uh-huh.
right? So anyways, they're cheap. You can pick them up at the grocery store
Walgreens,
or
$10.
Walgreens, whatever, stuff like that. And so you put them on your finger, and then wait a few seconds, and it'll give you a number, 2 numbers. One is your pulse, one's your oxygen. If your oxygen levels are I'm sounding it the right way. Let me talk about how to interpret the numbers.
Yes.
You get a number.
Yeah.
What you let's say, for example, you get 95, and you look at it, go 95. That's pretty good. I got 95.
That's passing.
Well, more than passing. That's an A.
Yeah.
If I got 95 on a test, I think, woohoo, that's excellent. No, wrong. Don't think of it that way. You want to think of a 90 as the bottom.
Oh, okay.
And 100 is the top.
Okay.
Now figure out what your percentage is. You got 95, that's 50%. That's a fail.
Yeah, that's.
Or is it a D minus?
I think it's a D minus, but still not adequate to pass.
Yeah, right. It's not, and you know it because if you're running 95 on your oxygens, you are tired.
Lethargic.
You do not want to walk up that flight of stairs, and if you have to give it a go,
And they're having difficulty breathing up that flight of stairs.
maybe not. Maybe not. The
Okay.
breathing may be a factor or may not be a factor. What will be a factor is you can't make it all the way up the stairs.
Without
you stop
taking a
halfway.
break, yeah.
You hold on to the rail, and you breathe,
Yeah.
and you try to rest, and you try to get your energy for the next surge up. That's what 95 looks like. 90, you won't get out of your car.
Okay.
90, you can hardly function. I mean, some people get so accustomed to it, they can kind of move around and function at 95. Those people usually with chronic obstructive pulmonary disease, and they become trained living at low oxygen levels. But any normal person, you go to 90, like you and me went to 90, we couldn't do anything. We couldn't do the show.
Yeah.
Not at all. Not sitting down, we couldn't do the show. So 90 is the bottom. 100 is the top, and then you can figure out where you're at on that one. So let's do it. If you're 99, you're great. If you're 98, that's a B. That's good enough. You get the job done. You're 97, That's, it's all right. You kind of mediocre. You got 96, you're having problems. 95, forget it. Now you know you can't function the way you need to function.
Are there any other measurement devices than the pulse oximeter?
There are, but those are in the hospital stuff.
Okay.
So we don't need to talk about that because it's all in the hospital. If you're that sick, you're in ICU.
Okay.
Right, and they're checking you other ways.
So then what is the deal? Why aren't people getting all of the air that is constantly available to us?
So in order to get the oxygen out of the air, it's got to be carried to your cells. And so it's easy enough getting oxygen in your lungs if you can breathe, and you just breathe in and it goes in your lungs. And then what the oxygen, the human body is designed to have the oxygen jump into this little box. Let me just keep it real simple. So there's these boxes, they're called hemoglobin. Inside each one of these boxes is an atom of iron. Oxygen likes iron. Mm-hmm. It wants to jump onto iron. His natural state of iron is to be oxidized. Mm-hmm. We know this in nature or in our world because you throw a nail out into the yard, you come look at it a day or two later, and it's all rusty.
Yeah.
That's what this is. Oxidized iron is rust. So that one atom of oxygen jumping onto the one atom of iron, that's rust. So you have a teeny little bit of rust. So there's millions of these little boxes inside of millions of red blood cells. So there's a lot of capacity to move oxygen. Anyway, so the oxygen, the little box inside the red blood cell, goes near the lung. The oxygen jumps on of its own accord. Yay, there it is. And then at that moment, if you just check someone's blood, it looks like they're well oxygenated because there's, the number's high. You're looking at how much oxygen is in there, it's quite a bit. Anyway, so these little boxes go over to the tissues, like your knee or your elbow or your earlobe, whatever, right? And then the oxygen jumps off, goes over to the cells and does whatever the cells need to do with it, respiration. Now it's empty, and it goes back and picks up more. Oxygen jumps on, goes over to the cells, jumps off, like that. That's how it works, except for it doesn't. It jumps on nicely, but why does it jump off? There's no point for it to jump. It was happy being there rusted. Mm-hmm. Rust doesn't unrust. It just sits there being rusted. No. The reason why the oxygen leaves the iron in the hemoglobin is mostly has to do with carbon dioxide. Carbon dioxide has an affinity for this molecule, this hemoglobin molecule, and it's got a slot on the bottom, 2 little slots for it to sit into, and so it'll attach to the hemoglobin molecule and cause the molecule to warp in such a way that it pushes the oxygen off.
So that the carbon dioxide can sit.
Yeah, and the carbon dioxide is what triggers the release of the oxygen.
Okay, so...
Now, this is weird. You think about it. Whoa. Carbon dioxide is a waste product.
Right.
We want to get rid of carbon dioxide.
Yeah, and if you have too much carbon dioxide, you risk carbon dioxide poisoning.
That's right.
So it seems kind of counterintuitive.
It does. And yet it's the way it works. It's reality. So if your carbon dioxide levels are low, your oxygen won't jump off the hemoglobin. And if you check someone's blood at that moment, it looks like their blood oxygen levels are high, except for the oxygen is going to the cells, not jumping off and coming back into the lungs, and it's already there, so none jumps on. So you're moving these millions of molecules of hemoglobin around and nothing's happening.
So would you say that it's not so much of an oxygen problem, it is a transfer of carbon dioxide problem?
Well, it's a transfer of oxygen problem, which depends on, the transfer, the availability of carbon dioxide. Now, the hemoglobin can move the carbon dioxide for sure, but the carbon dioxide can move on its own too. Now you're going to get me too deep into this thing. Because carbon dioxide is mostly not in the form of carbon dioxide, mostly it's in the form of bicarb, and that's another show. Now I'm doing acid-base balance, and let's not go into there. The basic facts are this. Oxygen, in order to get to our cells, has to jump on the hemoglobin, has to jump off the hemoglobin. In order for it to jump off the hemoglobin, carbon dioxide needs to be present.
So then how might people get more carbon dioxide?
That's an excellent question. Let me illustrate this, though, in kind of a fairly common scenario. That is, someone feels like they're not getting enough air. They get what's known as air hunger. People with asthma get this. People with COPD get this. People with panic attacks get this. It's a pretty common thing. You know, we see it fairly frequently. At least people who will tell the story that this is what happened to them. And so they feel like I'm not getting enough air, so they start breathing deeply. Because that's how you get more air, is you breathe deeply. And what they're in fact doing is they're blowing off their carbon dioxide. Because the more air you breathe, the carbon dioxide levels in the air is less than it is in your body. And so carbon dioxide rolls downhill. It rolls from high concentration to low concentration. And with you moving a lot of air, the low concentration in your lungs just drains your body of carbon dioxide. And so now you can't let the oxygen go. And so the more you breathe, the more you don't have oxygen. Now, isn't this crazy? It's counterintuitive, absolutely 100%. And now it makes you want to breathe more. This can get bad enough to kill you, and does. People die every year from exactly what I'm telling you. Now, mostly before they die, they think I'm having a heart attack, my lungs have done some kind of failure, take me to the hospital. And so they go to the hospital, they show up in the ER, and the ER doc says, oh, another one, you're having a panic attack, here's a paper bag. And so you put a paper bag on your mouth and you breathe in and out of the paper bag, and it cures you.
Okay.
Now, I'm sure.
So they'll be experiencing side effects long enough to get to the hospital, get in an intake, sit in the ER. They'll be feeling that entire time that they're having a heart attack.
Yes.
Okay.
Yeah, and what they get is they get, I'm going to get you too into it. You already asked the question. Let me tell you what they get. What they get is panicky. Mm-hmm. What they get is tetany. Their muscles start to contract. Mm-hmm. What they get is cold. Mm-hmm. What they get really is feeling like they're having a heart attack. Okay. They get pain in their chest. Okay. They're pretty much straight up heart attack. This is what looks like a heart attack. And so, but the ER docs have learned to recognize this, but mostly due to the panic. And they do some easy tests. Anyways, what they do, they don't necessarily have a paper bag. Like, who has a paper bag? Do they keep a supply at the ER? I'm not sure. They give them some kind of bag that traps the air. So now the carbon dioxide, instead of blowing out, is still right there.
So they
and
can
so it
have it available.
Traps that carbon dioxide, and instead of having the carbon dioxide pressure be low, it goes up high, and then the carbon dioxide flows back into the body, and
and then they can process.
I feel good. Mm-hmm. You cured me with a paper bag. That's amazing.
Thanks for the
$500
ER bill. Okay, so
that was $3,000, by the way.
Yeah. Well, okay, so if one isn't going to the ER, if they don't have an acute problem like that, but they do feel, tired, and they have been told by their provider, oh, your oxygen levels are low, how do people start to work on that to get the CO2 up, get the oxygen converted? What do they do?
Yeah, so in other words, that was an interesting story, Dr. Luper. How does that relate to real life?
Yeah, what do we do with it now?
Okay, that's an excellent question. Here's the thing. Some people have a hard time moving moving oxygen, not air, oxygen into their bodies. And so if we want to enhance their oxygen transfer, there's a pretty straightforward thing we can do. We can enhance their carbon dioxide. Now you think, no, they need oxygen out of the tank. Yeah,
in some cases.
That can help. I mean, you load up enough oxygen, it'll leak across, even though the transfer's not really working that well, and they'll feel better for it. But oxygen's also toxic. There's that. And if you look at people who are on oxygen chronically, they tend not to do any better than people who are not doing oxygen. I don't want to get into the research on this very much. Let me just say that it's not the best way to do it, and most doctors won't necessarily start there. Let me say that. What they'll start having you do is change your breathing pattern to increase your carbon dioxide levels, and it helps. There's a very straightforward, easy thing that you can do. It's known as pursed lip breathing. Y'all at home could try this if you have a problem getting your oxygen levels in. What you do is you breathe in through your nose and out through your pursed lips. Just like that. And what it does is it creates back pressure, and so your carbon dioxide levels will go up. Yeah, it's analogous to breathing through a straw. You trying to breathe out through a straw, and then it creates this back pressure. Except for, again, just like the paper bag, who's got a straw? I don't have a straw, so I got to figure out how to breathe out through a straw so that I can get the carbon dioxide levels to go up. Now, this is got a corollary that's interesting, which is if you chronically have a problem with this, or even acutely have a problem with this, your body knows how to solve that problem. It on its own can take your bronchioles and squinch them down into straw form. Literally constrict those bronchioles. This will create a back pressure, trapping carbon dioxide in your body and saving your life from this thing where the carbon dioxide levels get blown off too much. Right? You ever hear of somebody's bronchioles squeezing down before?
I haven't heard it, no.
That's called asthma.
Oh.
So everybody thinks that in asthma, the bronchial constriction is the problem. It's not. It's the solution.
Body trying to.
It's the body trying to fix the problem, and so the bronchial spasm is a way to create this back pressure to get carbon dioxide levels to go up to improve oxygenation.
What about holding your breath?
That'll work too.
Okay.
Yeah, you can do that too. Except for you ever try holding your breath when you have air hunger? It is impossible.
Yeah.
You won't do it because no one can hold their breath and feel like they're doing the right thing. And people who have air hunger, they want to breathe more. So what you're doing is controlling that urge to breathe more by breathing in through your nose and out through your pursed lips. And then you get the back pressure and you feel better. And it's interesting, it's not like subtle, it's like, wow, I feel better.
Yeah, no, I can, relate with certain breathing techniques that I've done on my own and having that almost instant after 3 or 4 or 5 rounds, then feeling that wave of relief.
So someone who's got a problem with oxygen transfer, someone who's got lung disease, for example, they have asthma or COPD or something like that, and they have to climb a set of stairs, they can do pursed lip breathing and get up the stairs. Whereas if they don't do pursed lip breathing, they make it halfway and have to stop. And after a while, since they know this works, they'll naturally just kind of fall into it. You get to kind of pick people with COPD out from a crowd because they're the ones doing the pursed lip breathing as they're trying to go from place to place. Interesting, isn't it?
Very.
So you can actually get oxygenation to improve by doing pursed lip breathing. That's the easiest, quickest thing to do. But you can get a better result if you breathe differently, and in fact, if you do breathing exercises. So I'll give you a couple examples. This increased carbon dioxide thing is useful in sports because if you can get a better carbon dioxide in your body and you get better oxygen delivery to your cells, you will be faster and stronger in aerobic sports like running or bike racing. Now, bike racers are now taught to breathe through their nose. These are the Tour de France guys. Because the nose will create a little bit of back pressure and allow them to actually get more power. And so you can get 6% more power on a bicycle by breathing through your nose.
Just solely breathing.
Yep.
In and out through your nose?
In and out.
Wow.
Through your nose.
Wow.
Now, if you're going to sprint, you're going to be needing more oxygen. At some point, you're going to have to breathe through your mouth. And so your oxygen transfer decreases, the efficiency of it decreases. But the end of the race is down there, right?
Sure.
So who cares about efficiency? We're just trying to get all across the line the quickest. But if you're in the Tour de France, turns out efficiency is super important because the finish is the last 30 seconds, but the other part is the other 5 hours. So you're going to do a lot better if you can breathe through your nose during the 5 hours and then through your mouth during the last 30 seconds.
Right.
Interesting, isn't it?
Very.
Okay, so there's another thing that you can do is you can heat your body up by getting your oxygen transfer to go up. This is analogous to, just remember, we're talking about energy.
Heat your body up
by getting more oxygen in your body.
Not getting more oxygen by heating your body?
What you do is if you can get the oxygen transfer to improve, then your metabolic rate will go up. You'll be warmer, you'll have more energy, your body will run better, you'll think better, the whole kit and caboodle runs better. This is a useful thing.
Yes.
So this captures everybody's attention. Like, what is he talking about? This thing where you get your body to run better? Yeah, absolutely.
Then you can breathe better.
The best thing to do this that I know of is Wim Hof breathing. Now, we've talked about Wim Hof before, but those of you who don't know Wim Hof,
I think everybody knows about Wim Hof by now.
Well, then I don't need to explain it, but there may be one or two out there.
Okay.
So Wim Hof's a Dutch guy who has done all kinds of ultimate, supreme, whatever, I'm using the wrong word, sports, where he is like the world record holder for holding his breath and swimming under the ice in a frozen lake, or climbing
Mount
mountains.
Everest, shoeless.
Was it Mount Everest?
I don't
Whatever,
know.
with this stuff like that.
Something crazy.
If it had to do with cold and water, he's a guy who probably has done it better than anybody, right? Seriously. So how does he do that? How does he stay warm? Well, he's really good at oxygenation, and he's learned how to do this. And
So have the Tibetan monks.
that is correct. Turns out it's cold in Tibet.
Oh yeah, very cold in the Himalayas.
And so those monks have figured out this breathing technique. By the way, that's where he got it.
Yeah.
Is from the monks.
Yeah.
And what they've learned to do is to get their carbon dioxide levels to go up, and they improve their oxygen transport and efficiency of the system. And they'll sit cross-legged, in the snowbank and start melting the snow around them because they generate so much heat.
Yeah.
For real.
So, okay, in our last few minutes, are there any other treatments, supplements, medications even that one might be able to take to promote the oxygen transfer?
Well, it depends on where the breakdown is in the oxygen transfer. If the oxygen transfer is in the lining of the lungs, I haven't figured out how to grow a new lung lining yet. I did have one patient.
Have you figured out any herbs or supplements that stimulate growth?
No.
Oh.
What I've been able to do is thin mucus to get it to where air will flow better, and relax the lungs if they're tight. And there's a bunch of herbs that are helpful with that one. Verbascum, otherwise known as mullein, is one. Tussilago, otherwise known as colt's foot. I give him the scientific name and then the common name of those two. Drosera, which I only know the scientific name. I don't know the common name for that one. Sundew, actually, I think is what it's called, is another one that's helpful. Glycerizer, we talked about that one before, tends to be helpful also. That's licorice root.
Yeah.
And so there's some herbs that you can do. The thing that you want to look at is figure out where the breakdown of the problem is. It's not always the lungs. In fact, it's not usually the lungs. The most common breakdown is in the blood itself, in the hemoglobin amount. If you're short of hemoglobin, then you're not going to be able to move much oxygen.
And then,
there's a name for that. That's called anemia.
And there are tons of supplements for anemia.
Yeah, so iron is the classic one, and sometimes it's an iron deficiency, but it isn't always an iron deficiency. Sometimes it's not a problem with making hemoglobin, because you need iron to do that. It's a problem with making cells. And if you have a problem making cells, then you're going to have anemia, because you have to make a lot of cells every day to replace the ones that died. The red blood cells only hang out in your body for about 3 months. And so if you're short of folate or B12 or both, then you can't make cells. Those are both necessary for the duplication of the DNA for cell production. If your body's just tired and literally you don't have enough energy to do anything, you're really sick for a long time, you're undergoing chemotherapy, for example, things like that, you get anemia of chronic illness, where your body just can't make the cells because it can't make anything.
Yeah.
And that'll happen as well. There's a bunch more stuff we could say about anemia. We should just do a show on anemia is what we should do.
I think that's next.
But let me say that there's a breakdown in anemia. So there can be a breakdown in the lungs themselves. There can be a breakdown in the red blood cell production. There can be a breakdown in the hemoglobin production. There can be breakdowns in we already talked about this, carbon dioxide levels available for the transfer. I'm thinking of all the different kinds of anemia in my head right now, what with sickle cell anemia and thalassemia and stuff like that. But again, it's outside the purview of this particular show. You know what I really want to do, I don't know how much time we have left, but to talk about the breathing technique again so folks can do it at home. I mean, you don't have to go see a doctor to do this breathing thing. You could try it at home. It's easy enough. What you do is you go online and you Google Wim Hof.
He also has an app too, where you can
excellent, and he's got it all figured out in terms of how to do this thing.
Exercise you want to do, and then it'll time you. And
so what you do is you just do what he says in the video. It's a snap. What it turns out to be is 30 deep breaths, and then when you breathe in your belly and your chest and your head, which is weird, your head, but that's the thing. Belly, chest, head. You do it 30 times, and then on the 30th breath, you breathe all your air out, just like you did every other time, and you hold your breath on the exhale, which is weird.
For how long?
As long as you can.
Okay.
So the weird thing is like for me, I can normally hold my breath for about a minute, maybe, a minute and some change. And if I do this deep breathing thing and then let my air out on the exhale, mind you, I can hold my breath for just short of 3 minutes.
Wow.
Amazing, isn't it?
Yeah.
And now the other weird thing is
and then when you pick up breathing again, are you just to continue breathing as normal, or?
Well, actually, you do it 3 times in a row.
Okay.
It takes about 5 minutes to do each cycle, which is not that long, really. Mm-hmm. And then you do 3 in a row, and it works better the more you do it. Mm-hmm. So it's good for practicing this. Mm-hmm. And then it takes about 15 minutes to do it, and you're absolutely charged up. The interesting thing is, since the oxygen transfer has increased so much with the carbon dioxide, then you can get more oxygen going to your muscles quicker, better, faster by doing this. So I gave it a go, and I'm not very good at push-ups. I can do like 25 push-ups, 30 if my life depends on it. And so while I was holding my breath, literally holding my breath on the exhale,
you pumped out 25 push-ups?
40.
Whoa!
My PR was while holding my breath
Yeah.
on the exhale, banged them out like nothing. Probably could have done more. I wasn't trying to set a record. I was trying to see how many I could do.
Sweet.
I'm not that young, really.
I mean, you're not that old.
I have a desk job.
Awesome.
So it's interesting to experiment and to figure out how to get the most out of your body, how to get the oxygen transfer to take place.
Did you do the push-up contest on the 3rd round of the breathing?
Yes, on the 3rd round. Actually, it was the 4th round.
4th round.
I did an extra.
Okay.
And decided to do push-ups right then and there. And this was because Wim Hof suggested to do it. And I just did what he said.
Awesome.
And, turns out this is a really helpful thing. And my patients who have COPD, I have them do the Wim Hof breathing, and they do fabulous. It's amazing to see how much better they do. It's been super, super, super helpful. One of the most powerful tools we have to help with COPD in my practice is doing this Wim Hof breathing.
Wonderful. I think that's all we have time for today, Dr. Luper, but as always, appreciate it. Thank you.
My pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.